Welcome to our webinar, Transformational Care Delivery, Moving from the I to the We. I'm Nancy Thompson, and on behalf of I2I Population Health, I'd like to thank you all for taking the time to join us today. I'm really excited about this webinar as we're going to be focusing on the importance of team collaboration. During the webinar, I'm going to be interviewing Dr. Matthew Tomaino. Matt is the founder of Tomaino Orthopedic Care for the shoulder, hand, and elbow in Rochester, New York. Dr. Tomaino will share some highlights of his 22-year journey as a practicing orthopedic surgeon and reveal how he transformed himself into a collaborative team member. Many of you may be familiar with Matt as he was our keynote speaker for our 2016 user conference this last May. His presentation left us all wanting more information on what he's done and how he did it. Before we begin today's webinar, please note that the webinar is being recorded and will be available for download after today. Just check your email for more information. And we will be taking some of your questions at the end of the interview, but you are welcome to submit your questions through the GoToMeeting panel on your screen at any time. We all know that building an effective population health strategy requires the right package of technology and expertise, which is really I2I's forte. But it also requires a high-performing team to execute that strategy. Today, we're going to be covering some foundational concepts on building synergistic and collaborative teams. The team concept in the healthcare industry is a growing trend and a crucial component in population health management and the patient-centered medical home care model. Whether you're a primary care provider who takes care of thousands of patients a year and has to make those crucial decisions on the spot, or a specialty provider whose care must be precise, accurate, and detailed, collaboration and the harmony of the team is of utmost importance. So with that, I'd like to introduce you all to Matt Tomaino. Matt, thank you so much for joining us today.
Nancy, thanks for inviting me to participate. It's really a privilege. And I'd like to begin by just saying that one of the revealing things about teamwork is how many articles and books are written on it and have been written on it, which is somewhat sobering to me in that it took me maybe 18 years into my 22-year career to kind of figure it out, and it's no surprise because it's very difficult to really hit the target sometimes.
I understand. So before we learn more about your journey, we've had a few questions about the connection between what we do as a company, which is population health management, and what you do, surgery. So can you tell us your thoughts?
Sure. And I think these principles really apply to many industries. But for me, looking at some of the ingredients to effective teamwork in population health management, and in orthopedic surgery, my world, there are a lot of similarities. Population health management certainly requires gathering and assessing a lot of data, and then developing services, and then ultimately engaging with patients so it all works. And successful outcomes require continual feedback to allow for process improvement and to ensure patient compliance. In the same way, as an orthopedic surgeon, effective patient care requires managing a lot of information and then developing, and most importantly, executing effective treatment strategies. And because none of us as individuals can possibly do this by ourselves, the process by which we do the work is achieved by relying on others. And so teamwork is critical. And in my mind, when it comes to teamwork, the silver bullet is when we can build a synergistic team where performance is greater than the sum of all of its individuals, even the most talented individuals. And this concept of a synergistic team requires appreciation of interdependency, shared responsibility for outcomes, shared identity as a social entity, and this creates a culture where there's truly mutual accountability. And this is critically important as a surgeon because even though I may have my hand on the scalpel in a particular operation, there's no way I can possibly perform my task without a team of individuals. So successful outcomes, whether it be in managing the complex health needs of diverse populations or taking care of patients with surgical needs, requires a diverse set of skills and competencies, and collaboration in that regard is absolutely critical.
Yeah, I do agree with that, Matt. The team is a really critical piece of the puzzle. So tell us what events led up to your light bulb moment when you realized the importance of a team and a team mentality.
Sure. The way I look at this is how I transformed my mindset from a talented individualist, if you will, into a team player. And, you know, after all, as a surgeon, I was trained that it's all on my shoulders. And this feeling is magnified, really, by the fact that in a particular room, there's a person on the table, and I'm the only one truly with the expertise to do the operation. The downside of that mindset is that we, as surgeons, may regard the stress we feel as ours alone, and our role in any poor outcome as a personal indictment on our competence, when in fact, it may be nothing of the sort. So the inflection point for me was actually when I was responsible for an error about 10 years ago. Unfortunately, my patient was okay, but I shouldered a disproportionate amount of accountability because I was a surgeon, even though a full assessment of the root cause revealed system issues, if you will. So it really transformed my appreciation of the value of team. As I mentioned before, the silver bullet is appreciating that with interdependency and shared identity comes mutual accountability, and this provides a really awesome opportunity for the team to reframe failures as collective learning opportunities. I was recently at a conference in Washington, D.C., and listened to a fellow named John Nance who wrote the book, Why Hospitals Should Learn to Fly. And he facetiously emphasized that we all, human beings that is, have carbon-based brains. We're all capable of mistakes. Yeah. And it's only through building mutually supportive teams and collaborating that we can minimize the consequences of our errors and at the same time use them as an opportunity to grow. So for me, I would say that when I stopped thinking of myself as an individual performer and became committed to the concept of truly needing others, is when I fully embraced the importance of team. Not a team assembled simply to support my task, but a team where we all needed each other and where no one person was more important than the other.
Interesting. Well, thank you. Thank you so much for sharing that bit of your journey with us. Let's chat about building a team for a moment. How did you go about assembling your team?
Sure. Well, it's really interesting. We don't really get an opportunity, believe it or not, to choose who's on our team in the operating room any longer, although historically we did. It used to be that you'd exit people if you didn't like them, if you questioned their commitment, or if they seemed to challenge your authority, or it took a little longer to learn their task. And this probably interfered to a large degree with the skill set necessary to elevate performance in underachievers or to address non-technical issues like poor communication or managing conflict. But in reality today, because nursing and other personnel are really precious resources, and there's a huge cost in any organization to simply exit people from teams when problems arise, we really can't afford to be as capricious about who's on our team. And I really think that teams in healthcare in that light are built over time through deliberate work within the team. And leadership requires often being a coach and a colleague more than a captain.
Got it. So, Matt, tell us more about your team. Who's on your team, and do you have a team leader?
Sure. In the operating room are myself, an anesthesiologist who's in charge of the patient while they're asleep, a scrub tech who passes me instruments, and typically an unscrubbed nurse who's doing a lot of documenting and the paperwork type of stuff. But the team's even larger if you consider the staff that checks the patient in when they arrive in the morning, the nurses in pre-op who get the patient ready to go into the operating room, and the nurses in the recovery room who recover the patient before they go home. And everyone has their own individual tasks, but collectively, the interdependence and shared accountability for the outcome really inspires the team to accomplish the ultimate outcome, if you will. Now, regarding leadership on the team, I'd say that there's really shared leadership. Anyone can assume a leadership role at the appropriate time when their own expertise and influence become central. It may not just be the surgeon. I constantly remind myself that leadership is a process of influence, not a position or a title. And so leadership in the context of team is no longer served well by a captain of the ship mentality, which I think I probably had in years past.
Got it. Well, I know that when we're talking about building a team, it always sounds so straightforward, but I know that that's not always the case. So what kind of challenges or barriers have you faced?
Well, great question. Each and every day, I think the team either develops or potentially regresses. And historically, I didn't really appreciate this. I was very focused on whether my task at hand went successfully. But when you're on a team, that's really not sufficient just to be concerned with the quality of your own work. Teammates, I think, either look forward to the next day or they dread it, and we need to be aware of that. We need to deliberately infuse oxygen, if you will, into the room via optimism and our mood as opposed to sucking oxygen out of the room. So it's ideal to think about how to continually build an esprit de corps as opposed to simply making sure we do our own individual jobs okay. Regarding challenges that I've faced or what the barriers to a high-performing team are, I really like to borrow from what Patrick Lencioni wrote in his book, The 5 Dysfunctions of a Team. The two fundamental barriers are the absence of trust and fear of conflict. Without trust and the ability to leverage conflict as a means to continue to develop, he maintains, and I've seen, that accountability and commitment suffer and ultimately results decline. And Lencioni describes inattention to results at the top of the pyramid as the quintessential consequence, but he's not referring to inattention to individual performance. He's referring to the collective performance of the team, which is really what I think inspires the relevance of the moving from the I to the we. Secondly, I never really appreciated the importance of the climate on the team or the wellness of the team. I was very focused on outcomes, as I've mentioned, and not so much in the social process by which things got done. And this social process or identity is central to team wellness. Do people feel valued? Do they feel respected? Do they feel that they are doing worthwhile work? And a lot of this actually, I think, requires a high degree of emotional intelligence. And the 4 pillars, which were on the previous slide, include self-awareness, self-management, that is controlling how you respond to situations regardless of what you may be feeling, so that your emotions don't sabotage your behavior. It requires social awareness, which is fundamentally empathy. And it requires an expertise at building relationships. So in a nutshell, the most fundamental challenge to being on a team is actually oneself. Because amidst challenges and conflicts, the only person that can reliably effectuate change on a team is oneself. Now, historically, as a surgeon, I thought my expertise alone would engender trust on the people on my team, and that they would support my task unconditionally. But what I failed to appreciate, Nancy, was that my intention was not always aligned with the impact of my behavior. My attention to detail might be perceived as too demanding. My aversion to variance might be perceived as rigidity or an unwillingness to compromise. And others might have viewed my extreme focus as being very self-absorbed. Now I've come to realize that it's absolutely critical for me on the team to model my intention very explicitly and to be aware of the impact of things like my mood and my demeanor on how other people appreciate me. If there's a gap between intention and impact, it can negatively impact the climate on the team and erode trust. And remember, trust is that fundamental building block of high team performance. It's the gateway to confronting conflict in a very transparent and productive manner.
Well, Matt, you've talked a lot about trust and conflict resolution. How do you assess your team and manage it on an ongoing basis?
Yeah, so how do you know whether you're on a good team and whether your performance is optimal, as good as it can get? And I think it depends on the metrics we use. Is it merely compliance with process mandates? Is it that the patient outcomes are good? It might be patient satisfaction, which is entirely different than the outcome as we may see it as providers. And lastly, our performance may be assessed differently if we focus on the satisfaction of our teammates. It might be fairly typical to think that team performance is merely a function of whether good outcomes are attained. I certainly used to feel that way. Hey, everything went great. The team must be functioning well. And in fact, sometimes it's completely opposite. We need to consider other metrics. So beyond process compliance and quality measures, we need to really assess whether the team climate or social wellness promotes information exchange ideally. Having trust on a team, as I mentioned, allows the status quo to be challenged. And it's only when concerns are expressed and behaviors are challenged that true innovation occurs. So if the strategy is to promote a learning environment on a team, then the norms of behavior like mutual trust and communication must promote that. And so for me, at the end of every day, I not only try to express gratitude to my teammates, but I most importantly ask for feedback. Not necessarily explicitly, but I really want to know at the end of the day whether everybody feels as though everything went well.
Got it. You know, many of our primary care organizations have switched to a team-based care environment for their population health management. What is your sense on how to overcome some of those barriers that you mentioned earlier?
Sure, and that's a really good question. And as they say, the devil's in the details. First, I think you'll see that individuals on high-functioning teams share a very deliberate commitment to subordinate their feelings, their individual feelings and opinions, to the shared purpose or goals of the team. And this gets into the importance of self-management, which we mentioned. This requires self-awareness and regulation. And we need to be good listeners. We need to suspend our assumptions in difficult times and be empathic, remembering at all times that the team trumps the individual. Second, we need to eliminate any perception of power imbalance. Every team member has a valuable perspective which must be harnessed. There can't be any hierarchy. In the airline industry, crew resource management changed the culture of never questioning the pilot to where anyone has the ability to challenge anyone. And in healthcare, a similar program, which I've been involved in as an instructor, is called Team Steps. And this emphasizes the importance of mutual support and situational awareness, where anybody can stop the line, if you will. It's an I've got your back mentality, and everybody buys into it. Thirdly, Nancy, I think we really need to destigmatize failure and lower the threshold for saying something can be improved. In the context of the operating room, or I would imagine in population health management, where collaboration is a necessity, there will inevitably be mishaps. But denying or spinning failure, or worse yet, punishing or judging it, which is more likely when low trust exists, deprives the team from a growth opportunity. The paradox of success, particularly in terms of building a high-performing team, is that it's built on using failures as a platform for correction. And I think it's completely different than how we would view Six Sigma-like aversion to variance in manufacturing, because the human element of performing high-performing teams absolutely mandates that we reframe conflict as an opportunity, as a real diamond in the rough, so that we don't miss the chance to continue to evolve as a team. Now, how do we do this as leaders on our team to ensure that we as individuals continue to grow? Well, I think it boils down to needing to deliberately solicit feedback, and regularly. We need to create an environment that fosters trust. Stephen Covey, who's a guru on this and has written in The Speed of Trust, says that trust is a function not just of our expertise, but of our character. Competence is about our capabilities. So we need to do our jobs, and we need to have the resources required to do our jobs. But as important on a team is our character, our integrity, and our motives, and we need to align our behavior with our values. I haven't always gotten that right, but in a nutshell, every team member must accept accountability for their sense of how they're doing, and we must provide an opportunity for dialogue to flesh out conflict so that it can be reconciled or resolved. And in just summarizing on my answer here, I'd quote Michael West, who is a true teamwork guru from Lancaster University in the UK, and he refers to this process as reflexivity. That is a daily reflection on not only how the tasks were accomplished, but how the process of accomplishing the tasks went, because that team climate is so critical.
Very good. This is good stuff. So let's talk about the patient on the team. What is the interaction between the patient and the team, and do you see better outcomes as a result?
Well, great question, and this is really, I think, evolved over time, but the interaction, in a nutshell, between patient and team, in my mind, is that the patient is on the team. I think this is probably one of the most transformational changes in terms of mindset for us physicians. This not only abolishes the historic expectation that information flow was one way from us to the patient, that we told them what to do and they did it, but it effectively assigns accountability to the patient and to us for actually listening to them. Our patients in this new framework have skin in the game. They are on the care team. And compliance, I think, and it's been shown, is much improved when the patient is engaged and has an equal voice and perceive that they are really partnering with us as a member of the team.
Makes complete sense. So Matt, as we're sitting here chatting, I see even more now how similar the concept of a high-functioning team in primary care and the concept of a surgical team really are similar. So bringing our conversation back to population health, any other commonalities that you'd like to share with us today?
Sure, and I think much of the previous discussion has gotten to the heart of the similarities, but I'd emphasize that within the various teams, whether it be in population health management or anything, competence alone doesn't ensure great execution and trust. Relationships have to be developed and managed. And then trust is critical to lowering the threshold for identifying problems. And these opportunities to address failure and conflict are critical to building team performance. We've all been in meetings where the elephant in the room isn't addressed because no one says anything, and typically that's because there's a low trust quotient in the room. So both an effective population health management strategy and an effective surgical team, in my mind, need to place the patient front and center, and getting their feedback as to how we are doing is essential, just as feedback from our teammates is essential. And it all requires, I think, that we as individuals develop as more emotionally intelligent leaders.
Got it. Okay, so one last question for you before we open it up to the audience today. How do the right systems and the right training support the team effort?
Well, this is a complicated question, but in my mind, Nancy, as I think about it, it all boils down to whether systems enable the values of the organization and the values of the team to be operationalized. Is there trust that we can make a mistake and have it generate a learning moment for all? Or is the culture one of blame or judgment before a fair assessment of what has happened occurs? Now, that having been said, in terms of real systems thinking, I think it's important to remember that we are all part of a system. And so we need to buy into the fact that we are then, as a result, either part of the problem or part of the solution. So we need to subordinate our own issues sometimes and truly leverage the influence of the team and its shared goals and its ability to flesh out conflict to facilitate improvements in performance via honest and respectful dialogue.
Got it. Okay, so in closing, Matt, how can we all, what are your closing thoughts on how we can all go from the I to the we?
Sure, and this is an easy thing for me to address, Nancy, because I sort of told my story in the keynote that you alluded to, so I'll borrow from those remarks, but I think it probably applies in some way to everyone. It involved changes for me from the inside out. A few years ago, I was on a dysfunctional team, and I just kept my head down. I tried to ignore it and do my job, and I didn't fully grasp that I was part of the problem because I was not part of the solution. I was asked once what needed to change, and I came up with a number of solutions, which included lots of other things and other people. None of it included that I changed. So I changed my mindset and identity as a leader, and I became more invested in changing myself and becoming a more collaborative as opposed to a directive or autocratic leader in the room. I no longer considered my perspective as surgeon on the team as more important or as the basis of my influence. Secondly, on a daily basis, I really began to deliberately foster making connections with people on my team, which meant being interested in them as people, not just for what their role on the team was. I just never really thought that was critical, but it is absolutely critical. That's the way to build relationships and build trust. Thirdly, I became interested in understanding what it is that drives others' behavior, particularly bad behavior. So as opposed to reacting to it because of a justifiable sort of animosity or reaction, I now try to really suspend my assumptions and replace judgment with inquiry, asking in my mind or explicitly, hey, what's going on? And being committed to seeking first to understand has really become my mantra. And it's through those crucial conversations that typically you elevate the esprit de corps of the team and build a relationship. And lastly, and probably most importantly, I've intentionally tried to be more humble, to be really careful not to be perceived as arrogant or as a way that isn't consistent with how I feel I should be perceived. And so for a surgeon, arguably, it's a fine line at times between having the necessary confidence and mojo, if you will, to do your job. The fine line between that and being perceived as arrogant or having hubris. So I found that expressing personal vulnerability has really helped to make connections with others. I narrate my anxiety in a difficult case or if I'm stressed, because it's through being vulnerable ourselves that we build the foundation for the type of trust that Lencioni really talks about, where it's okay to ask for help, it's okay to admit a mistake. And so it's all this stuff which is not at all related to our task-related competencies that really contributes to a synergistic team.
Great. Well, you know, I really think that that's wisdom that just about anyone can relate to inside and outside of the healthcare industry. So thank you so much, Matt, for your presentation. So go ahead and put in your questions in the question box in the GoToMeeting panel. And while you're doing that, I just wanted to bring your attention to some upcoming I2I training opportunities. We're going to be doing the Population Health Intelligence through Analytics course, where you'll learn how to use the custom report and dashboard writer, September 29th and 30th in Santa Rosa, and October 3rd and 4th at Chase Braxton in Baltimore, Maryland. And then we'll have the I2I Track 401, the Advanced Care Management course, both in Santa Rosa in October and Baltimore in the middle of November. And you could just visit our website for more information, and registration will be opening soon for those classes as well. And we'll be sending that information to all of you via email. So with that, I'm going to open it up to the questions, and there's quite a few that have come in, so I just thought I would go ahead and ask Matt a few more questions. So this one is a little bit of a long one, Matt, but it says, nowadays in the healthcare industry in general, there are many compliance mandates and checklists and the like to ensure quality and safety, and even in some cases ensure payment for services for funding. What is your perspective about these initiatives in terms of their impact on optimal team performance?
Nancy, that's a great question, because even within operating rooms, there are now performance management software tools whereby people can anonymously record and document problems in a room without any necessity for the concerns to circle back to the team for purposes of improvement. So my response to that is, I think that these mandates often are really important in terms of providing boundary rules, if you will. In my world, surgical pauses before you start an operation are what are called timeouts before an incision is made in surgery. Ensure safety, making sure antibiotics are given, making sure that necessary documentation is performed, all ensures a top-notch offering. And I'm sure there are similar mandates all across the spectrum of managing a population health strategy. The one caveat I think is really important to consider is how the team and the organization address performance gaps or mistakes that may be observed or reported. What happens far too commonly, at least within hospitals, believe it or not, is that there is often a rush to judgment regarding a cause of a problem, and there's often a tendency to prematurely blame someone or something. While an individual team member may be accountable in some cases, the root cause is typically much more complicated. And so, despite the importance of all of these mandates, it's critical to do a forensic regarding the process or the gap when a compliance issue comes to fore, because it's then that the learning points can be, I think, observed. And then most importantly, it needs to be circulated back to the entire team so that accountability is not a blame or a shame opportunity, but it's a learning opportunity.
Got it. Okay, this next question is interesting one. And it says, I have a team member who isn't doing their job and it's really affecting the whole team. Any ideas for that?
This is really common, and I think that you know, the issue really is how does it get addressed, and whether the team member really truly appreciates the disparity between where they are or how they're perceived and where they need to be, and then whether they, once they fully appreciate that, whether they're willing to try to make the transition. So sometimes, believe it or not, people just are not very self-aware and they don't get it, which is why in human resources, best practices often stipulate that at some point there's a sit down and documentation and a signing off and a plan and all that, because again, to simply exit a poor performer is a strategy that will keep happening. So there need to be processes to elevate performance. But if somebody truly doesn't get it, then I think they need to be exited from the team. And the question also I think that often arises is, to what extent that can one team member sabotage performance and have an impact on the whole team, and who then resolves that? I think it's very effective acknowledging that everyone on a team can be a leader, to be able to at least strive for the team to be involved in elevating performance. I mean, at the very least, people should be able to lean into the conflict and talk about it. And even then, if a person doesn't have the interpersonal skills or whatever to be able to have that conversation, that's when it needs to be dialed up a little bit. But I think it's ultimately, if it can be handled on the team, it builds the team. I mean, that's the way you build team, by spiraling up from managing conflict. Of course, there are going to be people who just, they need to be exited.
Yeah, Okay, this next question says, are there any words of wisdom that you have on getting staff buy-in to the team mentality?
Well, I think it's a talk like this where you can actually hear somebody who understands at the core the importance of team, can talk and say, listen, the defense mechanisms one may have that prohibit buying into team usually probably involve feeling underappreciated and some level of ego need that isn't being fulfilled, because there's absolutely, unless you're a software programmer that doesn't need anybody else in your world to market, sell, educate, etc., everyone needs team. And so it's really pretty self-evident if somebody can just let down their defenses. That having been said, I think modeling the appreciation of team by others can gradually have an impact. And that's where I think this leadership from the inside out comes to fore. And also another term that's very relevant to me is that our actions create our reality. So when we do encounter a challenge or a difficult person or whatever, we have to very carefully craft our own behavior that then creates our reality. We respond to a negativity in turn, and we're not going to get a good reality. Whereas if we have the ability to manage how we respond to negativity or whatever, often it creates the environment for positive change.
That makes sense. And one last question is about feedback. How do you gather feedback from your patients?
Well, the way I do it is two ways. Firstly, every patient I see in the office, Nancy, gets mailed, emailed, or texted a commercially available anonymous feedback form that many will fill out, and I review those weekly. Most of them are favorable, but the ones you want to hear are the doctor didn't seem to spend enough time with me, or I wish he had given me more details on the operation, that kind of thing. It's great because it's only through the feedback that you get better. But in the office, what I do often is simply at the end of an encounter, I'll say, okay, great, do you have any questions or concerns? And they may say, nope. And I say, okay, super, well, it was great meeting with you. Do you have any questions or concerns? And I probably say it 2 or 3 times, and that's the opportunity to truly demonstrate that you are listening and that you're asking for feedback. However, you have to create an environment where there's no hierarchy so that somebody isn't afraid to give you the feedback. So it's a two-way street. We may ask for feedback and not get it, but we then have to always look in the mirror and say, are we behaving in response to the potential for feedback in a way that facilitates that? But I think it's really critical to regard feedback not as a dagger in the heart or as some kind of an indictment. It's neither right or wrong or good or bad. It's simply information, and we can choose to respond to it if we like.
That's really smart. Yeah, that's good information. Well, I'm sorry to say that we are out of time. On behalf of Dr. Tomaino and all of us here at I2I, I want to thank you all for taking the time out of your busy schedules to attend today's webinar. There were a few questions that we did not get to, and we will connect with you to answer those questions directly. For more information on I2I solutions, just go ahead and visit our website at www.i2ipophealth.com. Thank you so much for attending, and have a wonderful day.